The Year in Review is an annual opportunity for all wildland fire responders to revisit significant events and statistics from the past year to identify lessons we must learn to prepare for the coming year. The information presented is collected from numerous sources, all available for independent exploration to build your big picture situational awareness throughout the year. The National Interagency Coordinating Center is the focal point for coordinating the mobilization of resources for wildland fire in the United States. NIC also provides intelligence and predictive services products to support wildland fire and incident management decision-making. One such product is the Wildland Fire Summary and Statistics Annual Report, which collects information from the Situation Report and Incident Status Summary programs and the Interagency Resource Ordering Capability System to provide a national perspective on annual fire activity.
Total fires and acres burned increased in 2022 over 2021 by 10,000 fires and 450,000 acres. In 2022, the national preparedness level did not reach PL4 until September 6th, the latest date in recent history. We never hit PL5. In 2021, we hit PL4 June 22nd and PL5 July 15th. 2022 tallied 10 days in PL4 and 0 days in PL5, compared to 31 days at PL4 and 68 days at PL5. Less than 1/4 of the nation's total fires occurred on federally protected lands, yet over half of total acres burned were on federal lands. 89% of all fires were human-caused, yet 56% of total acres burned were from natural fire ignitions. In the following sequence, the graph on the left displays the number of fires in 2022 compared to 2021 for the geographic area highlighted. The chart on the right shows acres burned. Pop-outs feature a notable fire from each geographic area. Alaska burned 172% more acres than its 10-year average, the most acres burned in a single geographic area. Total acres in the eastern area fell 21% below its 10-year average. The Great Basin burned 60% fewer acres than its 10-year average. Total acres in Northern California dropped 73% from its 10-year average. The Northern Rockies totaled 63% fewer acres burned than its 10-year average. Total acres in the Northwest dipped 47% under its 10-year average. The Rocky Mountain area burned 49% fewer acres than their 10-year average. Total acres in the southern area climbed 70% above its 10-year average. The Southwest consumed 91% more acres than its 10-year average, the runner-up for most acres burned in a single geographic area. Total acres in Southern California dropped 77% below its 10-year average.
Experts at the Wildland Fire Lessons Learned Center analyze incidents and trends in the field to rapidly share lessons to improve safe work performance and organizational learning for all wildland firefighters. The LLC Annual Incident Review Summary is a collection of the past year's lessons condensed into manageable excerpts and actionable follow-up exercises. The year-end infographic provides a quick glance at statistics and lessons from the incident review summary.
Hard hats are required personal protective equipment, but they do have a lifespan. When was the last time you inspected your hard hat? The Wildland Firefighter's Helmet Serviceability Guide shows the proper method to determine if your hard hat needs to be replaced. Begin by determining the date of manufacture. These indicators are stamped into the brim. On the left, the large number in the center shows the year of manufacture. The arrow points to the month. On the right, the arrow points to the day of the month. In this example, the date of manufacture is June 6, 2021. If your hard hat is more than 10 years old, it must be replaced. Hard hats may need to be replaced sooner. Perform a visual inspection of the hard hat shell. Check for cracks, delamination, and discoloration. If found, replace the hard hat immediately. Inspect your suspension system for cut or frayed straps and broken suspension keys. If found, replace the suspension system immediately. Perform a compression test. Using your hands, compress the hard hat shell from both sides about 1 inch and release the pressure. The shell should return to its original shape. If your hard hat is less elastic than a new hard hat or cracks during a compression test, replace it immediately. Firefighters involved within short-haul extraction medevacs have expressed uncertainty about the required canopy opening size. With the right flight conditions, a canopy opening the size of a Volkswagen Beetle is required. Final site approval is ultimately up to the pilot and crew. Conditions that affect site selection and approval include weather, visibility, and flight crew comfort levels. Do not rely on short-haul availability as a justification to take on more risk. Do not delay requesting short-haul when you need it. The sooner the ship arrives, the sooner the operation can be evaluated. In April 2022, a firefighter assigned to a prescribed fire was found unresponsive at the conclusion of the burn. EMTs on site started CPR and utilized a nearby AED to reestablish breathing and a heartbeat. Do you and your crew know where your AED is? Are you trained to use it? When did you last check the expiration date on your AED's pads and battery? To save a life, an AED needs to be working, nearby, and in a known location. Make AED inspection a part of your module preparedness regimen throughout the season. You never know when you will need it.
Having considered the past, wildland firefighters must also look to the future. The National Interagency Coordination Center's Predictive Services Program provides information to support proactive decisions when anticipating fire activity and allocating resources. The National Significant Wildland Fire Potential Outlook is published monthly and identifies areas with above, below, and near normal significant fire potential by month for the next 4 months from publication. Other Outlook products include 7-day significant fire potential and fire weather, fire danger, and fire potential reports specific to each geographic area. Studying the past and anticipating the future help inform our actions in the present. In its mission to enable interoperable wildland fire operations among federal, state, local, tribal, and territorial partners, the National Wildfire Coordinating Group consistently distributes need-to-know information to enable safe, effective, and coordinated wildland fire operations in the here and now. The National Wildfire Coordinating Group released updated burn protocols in January of 2023. The NWCG burn protocols provide flowcharts for burn injuries and emergency department burn evaluations, as well as burn injury care guidelines for hospital providers. These references will assist personnel in the field to better assess burn injuries and expedite transport of injured firefighters to the appropriate level of care, as well as aid emergency department medical providers in understanding the unique demographics and working conditions of wildland firefighters.
A critical change is the recommendation that any significant burn injury be seen at the nearest emergency department. We no longer recommend bypassing an emergency department to go directly to a burn center.
Going directly to a local emergency department allows for immediate interventions such as fluid resuscitation, pain management, escharotomy, and airway management. When necessary, these life-saving interventions must occur rapidly and should be done at the closest emergency department. Delaying treatment by bypassing an emergency department to get to a burn center may cause significant harm. We recognize that air ambulances have destination protocols that they follow. In the field, we should defer to their local expertise as to where they transport the patient.
An additional update addresses what happens after you're seen at the local emergency department. While some critical burn patients will need to be transferred to a burn center directly, most may be discharged with close follow-up. However, just because you're discharged doesn't mean the treatment is over.
Burns develop over the course of days to weeks. It may be impossible to tell what the eventual outcome or long-term treatment of a burn will be at the first visit. Patients are often discharged and referred for continued treatment days or weeks after the initial injury. A local clinic, wound care center, burn center, or telehealth visit are all options to monitor the development and healing of a burn. It is imperative that you follow up, whether that be virtual or in person, with recommendations of the emergency department.
When in the emergency department, make sure to ask where to follow up and in what time frame. Ensure this information is documented in your paperwork for workers' compensation claims. Most emergency department discharge instructions will include this information. Make sure you understand the instructions. If at the end of your visit you would like a referral to a burn center, ask the attending physician. Remember, if you're discharged and the wound starts to look or feel worse, seek additional medical care as soon as possible. Burns are dynamic and can change rapidly.
The NWCG burn protocols were developed by the Emergency Medical Committee in collaboration with the Risk Management Committee and the medical community to better align with current clinical practice. The burn protocols are available on the NWCG Emergency Medical Committee webpage and will be published in the Interagency Standards for Fire and Aviation Operations, or Red Book, and in future generations of the Incident Response Pocket Guide. Thank you for taking the time to familiarize yourself with the NWCG burn protocols.
CIM is the new business model for management of Type 2 and Type 1 wildland fires. Complex incident management teams provide the same service as Type 2 and 1 teams and leverage the tenets of the incident command system to expand and contract to efficiently meet incident needs. This results in fewer team transitions and enables more efficient management of rotations, personnel, and assignments. 2023 is our transition year. More teams and geographic areas will move to CIMTs. All complex and Type 1 IMTs are included in the national rotation. Type 2 teams are still available. All teams will have internal rotations determined by their geographic areas. Additional coordination is important this year to manage the 3 different team types. As of January 2023, over 700 responders are available in IROC with complex command and general staff qualifications. For more information and to provide constructive feedback, please visit the IWDG website. You'll find all memos related to the implementation of complex incident management, additional videos, and our story map, which is regularly updated with correspondence, data, and answers to frequently asked questions. Thank you.
The past is written. The future is uncertain. The present, fleeting. Time marches on. But now is always here. Study the sources, look for the lessons, share what you find with the people around you. Act now and throughout the year to have a safe and informed 2023.